Hello, everyone, and welcome to Anatomy. We're going to kick this semester off with a quick introduction to some of the major themes and concepts that you should know. So, with anatomy, we're looking at the parts, the what it is, the structure of the body, and the relationship to each other, to the other parts. So all of the physical identifications, that's what we're talking with anatomy. When we talk physiology, we're talking more about how it works. So anatomy, what it is, physiology, what it does. So there are different branches of anatomy. We have gross. Gross means large. If you guys have had medical terminology, it would actually set you apart from most because we do use a lot of Latin-based terms here. So gross anatomy, large and visible body parts. Gross anatomy, think about the parts as a whole that are visible to the naked eye. Heart, an arm, veins, things like that. Then we have regional, so those are the sections of the body. So think abdominal region, pelvic region, and everything encompassed within those regions. So if we're talking pelvic region, we're talking about all the structures within it, including tissues, including organs. Systemic is when we're studying by the system. So digestive, for example, starts with the mouth and ends with the bottom. You're going through a lot of different regions there from start to finish. Surface anatomy is identifying things through the skin. So feeling through the skin to see what feels right, what doesn't feel right. Physical therapists do this, massage therapists do this, chiropractors. So that's all surface anatomy. You can do that yourself by feeling for any nodules. So think about in your glands or if a doctor's, touching your glands to see if anything's swollen, breast exams for lumps. So that's all surface anatomy. Microscopic anatomy is exactly what it sounds like. It's looking through a microscope, and it's looking at the cells individually. Cytology, cells, CYT, is talking about cells. Histology, histo, tissues, and this is all with the use of a microscope. So we're not looking at the entire organ, we're looking at the cells that make up a part of that organ. Then we have the developmental approach, so how each organ or organ system or tissues change over the span of birth to death. When we talk levels of organization, we always look at it from simple to complex. So the smallest unit of a chemical is an atom, right? We all know this. Atoms are tiny units that make up chemical molecules. So think of hydrogen, think of oxygen, think of carbon, think of the periodic table, right? These combine and they form a molecule. So H2O, which is water, CO2, which is carbon dioxide, CO, carbon monoxide, and these different chemical molecules, when they all combine, they make up cells. And cells are our smallest unit of life. That's where life begins, is at a cell. Or that's one of the tenets of cell theory anyway. If you guys have taken a biology class, all life is made up of cells. The cell is the most basic unit of life, right? Every cell is made up of organelles. So, systems are made up of organs. A cell is made up of organelles. We're going to talk about that in a couple chapters. Those organelles are made up of molecules. So you guys are kind of seeing how this goes. Those molecules are made up of atoms. So where are we? We're on number 3. So cells. Once cells form a group, they have now made a tissue. So how all these cells have made a tissue, similarly, a bunch of tissues together form an organ. So a lot of tissues with similar cells with similar common function, put 2 or more of these together, boom, an organ. And then we move on to organ system, same thing. Organ system is a bunch of organs working together. And then the organism is what happens when all of these things work together to make a functioning you and a functioning me. right? So we start really simple, really small, and we get pretty complex. So in A&P1, we'll be going over the first four in depth. So integumentary system, skeletal system, muscular, and nervous. Anatomy 2, we talk endocrine, cardiovascular, which I added circulatory here because anytime we talk blood vessels, you always talk circulatory as well. Cardiovascular says heart and vessels, but we're talking blood vessels throughout the whole body. We want to mention circulatory. But anyway, endocrine on is all going to be anatomy 2. Anatomy 1 is going to be these first four. When we're talking systems. Sorry. But you'll need to read through these and familiarize yourself with what organs are in each system and kind of what each system does. So integumentary, that's skin, hair, sweat glands, nails. That protects us against environmental hazards, helps regulate our body temperature through sweating, provides sensory information. And we have skeletal, bones, cartilage, ligaments, bone marrow. So that's support and protection for other tissues, calcium minerals, forms blood cells. Muscular system, so skeletal muscles and associated tendons. They provide movement, protection, support. They generate heat that maintains core body temperatures. And then our nervous system. So nervous system is going to be the brain, the spinal cord, different peripheral nerve sense organs. So those are immediate responses to stimuli, movement. They interpret the information around us, send information to other parts of us. We'll learn about that very, very in depth towards the end of the semester. Then in anatomy 2, that's where we start with endocrine. So the glands, long-term changes of organ systems, metabolic activity, energy, functional changes during development, cardiovascular and circulatory, heart, blood vessels. You'll have to know in anatomy 2, you'll have to be able to trace a drop of blood through the heart, for example. We have our lymphatic system, so that's our defense against disease. So spleen, thymus, lymphatic vessels, lymphatic lymph nodes, tonsils. Respiratory, so it's all about breathing, right? I'm not going to read through all of those. Digestive system starts at the mouth, ends at the bottom when you're in the toilet, right? Or dropping something into the toilet. Urinary system, kidneys, ureters, urinary bladder, urethra. So we are excreting waste products from the blood. We're creating urine, regulating pH. And then we have both the male reproductive and the female reproductive systems as well that you learn about in anatomy 2. Anatomy 2, we also talk about pregnancy and labor as well to round it all out. So the next few slides will be touching on how the body systems react to one another. So we start with homeostasis. Homeostasis is all about reaching a point of balance, right? We always want to reach a point of balance and be in homeostasis. So how does this work? Do we stay in balance all the time? The answer is no, but we always want to reach homeostasis, right? So let's discuss what happens if a stimulus causes some sort of imbalance. So stimulus throws us off balance. Receptor is going to pick up on that change, right? We're imbalanced. Receptor picks that up. It's like, oh, hey, something's wrong here. And it senses that something is off. So that information is then sent to a control center that is usually the brain. And then the brain sends out a response and kind of tells what needs to happen to fix that imbalance. So it sends that to the effector. So the effector is the thing that can make that change to get us back into homeostasis. So that effector is going to do the response that the brain told it to do so that we can reach balance again to be in homeostasis. One of these cycles is called a negative feedback loop, and we have negative feedback loops galore, right? We have this happening all day, every day in a lot of different scenarios. We'll talk about a lot of different negative feedback loops in both Anatomy 1 and in Anatomy 2. An easy way to think of it is this thermostat example. So if the stimulus is that your body temperature is rising, which we don't want too high, right? You don't want a high fever. You'll start frying your eggs, if you will. You'll start degrading proteins, cooking your brain cells. We don't want that. They'll never go back to how they were if you destroy them with really high temperatures. But anyways, your body temperature is rising, and you have temperature sensors in your skin and brain that are saying, whoa, it's getting hot in here. So these sensors or receptors are sending this info to the control center, and we got to get this body temperature down. How can we do this? So one way is to sweat. Sweat glands are the ones that make you sweat. So the control center tells your sweat glands to start sweating, and then evaporation of sweat is actually what causes the body temperature to cool back down to homeostasis. So then we don't have any more stimulus, right? We've cooled back down. We're back in balance, back in homeostasis. Now, that being said, if you sweat too much and you get too cold, something that can happen is that your receptors are now telling your control center that you are too cold. And then your control center is going to tell your effector, all right, you got to get this body temperature back up a little bit. What do we need to do? And your effector tells your muscles to start shivering. So that movement is that shivering movement of your muscles actually generates heat, warms you back up, and now you're back at homeostasis. And that's how a negative feedback loop works. You never get to homeostasis and just stay there forever. When you stop making changes, when these negative feedback loops end, you're dead. So negative feedback loops are constant cycles to get the body back to balance, and we're constantly in balance and out of balance. If that makes you feel better about why you're hot one minute and cold the next minute. So that being said, there are such things as positive feedback loops. Positive feedback loops are a little bit different, and there's actually a little bit less of them. There's still a lot, but not as many. There's not as many positive feedback loops as there are negative feedback loops. But anyways, that's not important right now. Positive feedback loops only go in one direction, so it's not cyclical like negative feedback loops are that are going in circles forever and ever and ever. Positive feedback loop is one direction until the process is done. So an easy example to think of is childbirth. It's a process in one direction that ends in a birth of a baby, right? Contractions, 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 childbirth, out pops a baby. Really simplified method. We talk about it a lot more in depth in Anatomy 2. We won't get into it in Anatomy 1 as much. But the example that we use in this slide is blood clotting. So there's a break or a tear in a blood vessel. You start bleeding. Platelets rush in and stick to that bleed. They send info to the brain that we need to keep plugging this bleed. So that causes more platelets to attract, causes more platelets to attract, and that attracts even more platelets, right? Until the bleed has completely stopped. So that's what we want. Platelet plug forms, no more bleeding. If this example were a negative feedback loop, it wouldn't work because you'd bleed a little, clot a little, bleed a little, clot a little, bleed a little, clot a little. So you never actually would close off that bleed if it was a negative feedback loop. So that's why positive feedback loops are important to, plug a bleed or pop a baby out, for example. Anatomical position. So everyone in the world uses this to discuss a patient. So you have to know anatomical position. If you don't know, you're going to know, and you're going to remember it forever because this is important. If you know anatomical position, then you're going to be pretty halfway there for this class because a lot of it is going to deal with knowing what you're looking at and what side you're looking at, right? So first things first, we always look at patient left and patient right. This side is patient right. This side is patient left. So don't get that confused because you will be asked left versus right. And a lot of students get it wrong. If you do, then your grade is going to suffer. So you need to be very, very, very familiar with patient left and patient right. It is the opposite of what you would consider left and right on yourself, right? Correct? Correct. So we always discuss a patient as if they were in anatomical position, whether or not they're curled up in a ball, laying on their side. We always discuss a patient as if they are like this. So the body's erect or straight, feet are slightly apart, facing forward with palms facing forward. And the patient can either be laying face up, so supine, or prone, lying face down. Supine also, supine has UP in it, so up. Think of supine position in the hands, for example, as holding a bowl of soup. So that's how you know how the hands are supposed to be placed. Prone is lying face down. Usually when we're talking about anatomical position, we're talking about supine. So lying face up. Pinkies toward the middle of the body, thumbs out. Supine, holding a bowl of soup. If you can remember that, you're going to be pretty good. So directions, make note cards over these. Practice, because you will have to know this for the rest of your career, especially if you're going to stay in the sciences or medical field. Make note cards over them if they don't come naturally to you, and practice until it becomes second nature. These directions always come in pairs, so we have superior and inferior. They used to be called cephalad and caudad. So cepha means head, cephalad, so toward the head. Caudad means tail, away from the head. They're not really used that much anymore. We always typically use superior or inferior. At least since I've been in this realm, it's been superior, inferior. So superior toward the head, inferior away from the head. We have ventral and dorsal. So ventral or anterior is the belly side. Dorsal or posterior is the spine side. So you can remember posterior. Some generations call posterior the hind end. That's on the back. So spine side. If you are a fish person, remember the dorsal fin is on the spine of a fish. The ventral fin is on the belly of a fish. So ventral, anterior, belly. Dorsal, posterior, spine side. Medial is toward the midline of the body, so center line. We'll look at an image pretty soon. And then lateral is going to be away from the midline. Those are used all the time. Proximal and distal, we talk about arms and legs only here. So proximal is going to be towards the trunk. Distal is going to be away from the trunk. And then we have, a good example for proximal and distal to think about it is, so remember we're talking arms and legs only. The wrist is going to be distal to the elbow, but the elbow is going to be proximal to the wrist because the elbow is going to be closer to the trunk. The wrist is going to be further away from the trunk. But remember those two. The trunk is the center section of the body. So abdominal, thoracic area, which we'll talk about in a second. Superficial toward the skin, deep away from the surface. So superficial toward the surface, deep away from the surface. We talk about this a lot with skin. So muscles are superficial to bone. Bones are deep to muscle. Superficial cut is a cut that's not that deep on your skin, for example. Yeah, and that's it. So make note cards over these because they will be coming up this semester and next semester. Ipsilateral and contralateral. So ipsilateral, if that's difficult for you to remember that it's on the same side, think contralateral, opposite side. So remember all these happen in pairs. Contralateral, contrary, you're opposite to what somebody else is thinking or saying. Then ipsilateral is going to be on the same side. Bilateral, so bi means two, so that's something occurring on both sides. Unilateral, occurring only on one side. So you have bilateral hip pain, for example. You got hip pain on both sides. Or unilateral hip pain. And if you say unilateral, that it's only on one side, say which side it's on, left or right. And we have palmar hand or plantar foot. So palmar and dorsal, talking hands only. Palmar is the palm, dorsal is the back of the hand. And then plantar and dorsal, we're talking feet only. So plantar is the bottom of the foot. Plantar dorsal is going to be the top of the foot. And then sometimes we see combined terms like superlateral, so it's not exactly superior or lateral, but it's both. Inferomedial, it's not exactly inferior or medial, but it's both. You'll see that coming up, but we'll talk about those as they come up. So just remember palmar, plantar, foot, hand, and then dorsal is talking about the foot or the hand. So palmar is the palm side, dorsal is the back of that. Plantar, think plantar wart, it's on the bottom of the foot. Dorsal is going to be opposite of that, so top of the foot. So here's the anatomical directions with pictures. So notice patient left, notice patient right. Not your left and right, but the patient's left and right. Notice the anatomical position. Now her feet should be a little bit further apart to be in anatomical position, just like the skeleton up here. So she's a little bit wrong, so pretend like her feet are spread out a little bit more. But proximal and distal, remember we're always talking arms and legs there. Anterior and posterior, or ventral and dorsal. We're talking belly side, back side. So right there. Superior and inferior is all trunk and head, no arms or legs. So superior, inferior, that's the trunk right there. That's the trunk. And then you guys know what the head is. And then the midline of the body is the center of the body. Medial is towards the midline. Lateral is away from the midline. So sectional anatomy, planes and sections. So this is a cut of the body. The plane is the cut. The section is what section of that cut we're looking inside. So sagittal divides the left and the right. Mid-sagittal divides them evenly between left and right. Parasagittal is unevenly left and right. We're not going to look at too many things that are parasagittal. Just a heads up, but know that it's para is uneven, so. But mid-sagittal is directly in the middle, evenly divides the left and the right side. Frontal or coronal divides the anterior and posterior. Frontal is usually what we use. Coronal is used sometimes. It's kind of phasing out, but know that that is the same thing. That divides the front and the back. Transverse, you don't usually see horizontal plane, but you do see transverse plane a lot, or a cross section. I talk a lot about cross sections. So transverse, horizontal, cross section, all of that's the same. That divides the superior and inferior, so top and bottom. And then oblique is diagonal between horizontal and vertical planes. You don't see a whole lot of oblique sections. You see them in some cellular slides. So frontal section, that's this cut right here, divides the body into the front and the back. And then the frontal plane is the cut. The frontal section is this section that you're looking at, the liver, the heart, the spleen, left and right lungs, arms, stomach, everything that you can see. Transverse plane, so this is a transverse plane right here. It's taking a cross section cut. So this is the cross section that you see, or the transverse section that you see through the torso. So how do you know what direction this person's laying in? What I always do is I look for the vertebrae. Vertebrae is right here. You see the little rib bone, little rib pieces right there. You see the liver, aorta, giant blood vessel that you'll get to look at in anatomy too, spleen. But a big factor when you're looking at cross sections like this is figuring out what side you're looking at. So if this is the vertebrae right here, you kind of know how this person's laying down and how you're looking into this. And then we have the sagittal section. So we have a cut in the mid-sagittal plane. Remember, mid-sagittal is an even left and right cut, and then the mid-sagittal section is what we're looking at. So the plane is the cut, the section is everything that's in there that you can see. Intestines, vertebral column, rectum. Let's see. Cavities. Okay, so cavity, let's just get directly into it. Cranial cavity is right here. What sits inside the cranium, the skull, what sits inside of it? The brain. So the cranial cavity houses the brain. We have the vertebral canal or spinal canal right here. Houses the spine. Pretty easy, right? Thoracic cavity right here or right here. So that's all chest, no abdomen. That's your lungs, heart, mediastinum. Inside the thoracic cavity, you have the pleural cavity. Anytime you see pleural anything, those are the lungs. And you have the pericardial cavity. So peri means around, cardio is heart, so cavity around the heart. Pleural cavity houses lungs, pericardial cavity houses the heart. Diaphragm's right here. Diaphragm is not a cavity. It is a muscle that separates the thoracic and the abdominal cavities. And then right down here, we have the abdominal cavity. Actually, we have the abdominal pelvic cavity, which is divided into the abdominal cavity and the pelvic cavity. Inside the abdominal cavity, you got liver, stomach, intestines, etc., etc. Pelvic, reproductive organs, sigmoid colon, everything that houses pelvic stuff. So, membranes. So I just mentioned the pleural and pericardial cavities. In the pericardium, the pericardium is the layers that surround the heart. Those actually have names. They are called serous membranes. Serous membranes surround the heart and lungs. They also line the abdominal cavity, and they have to do with what the organ within them is. So they're all made up of 2 layers, and they all have fluid in between. So serous membranes are around the heart, the lungs, and the lining of the abdomen. The layers that line the organ are called the visceral serosa. So viscera are organs. Visceral serosa line the organs. And the parietal serosa is what lines the walls. So the visceral serosa essentially vacuum packs the visceral organs. The part that lines the cavity is the parietal serosa, the outer balloon wall, if you will, in that example. If there are any problems with any of these layers, one is called pleurisy, inflammation of the pleura, the lines of the lungs. So apparently this one is really, really painful. It feels like sandpaper. Actually causes patients to breathe really shallowly. And then if the breathing gets very shallow, that actually increases fluid buildup, which isn't good. So doctors want them to cough, but coughing apparently feels really, really painful as well. Pleurisy is something we don't want. And then inflammation of the pericardium. So that's pericarditis, and that's the inflammation of the pericardium that lines the heart. You've probably heard of this one. That one's a little bit more common. Moving on to regions and quadrants of the body. So this is a 3x3 grid of the abdominal pelvic region, and there are 9 of these. Again, remember, no patient left, no patient right. This is the easiest to mess up. So pay close attention to detail and please understand the difference. We have the left and right hypochondriac regions. So this isn't, hypochondriac as what you would think of. Hypo means low. Chondra is cartilage. So the hypochondriac region is going to be below the cartilage. So what we're talking about there is rib cartilage, and we have a right section and a left section. Epigastric, epi is superior or above, Gastric is stomach. So epigastric is going to be above the stomach. Lumbar always means back. So left and right lumbar regions are going to be around the left and right back area. And then left and right iliac or inguinal regions, that's going to be the pelvic or the groin area. So we talked epigastric, above the stomach. We also have hypogastric, which is below the stomach. And then between those is the umbilical region, so right behind the belly button. So let's look at a picture so we don't get too confused with all of these. So get a note card and draw these out. The biggest ones that get confused is the epigastric and the hypogastric. So students want to put epi and hypo right below it, but epi's the top, hypo's the bottom, and the umbilical region is in the very middle. And then you have your right and left hypochondriac regions, your right and left lumbar regions, and then your right and left iliac or inguinal region. Either one's right. I usually say inguinal. You can say iliac. Not too big of a deal for me. But know your lefts, know your rights, and then don't get the center messed up. Also be able to tell me which organ is in which region. So speaking of regions, we have abdominopelvic quadrants as well. So these are very, very, very common. Right upper quadrant, right lower quadrant, left upper quadrant, left lower quadrant. First we say the side, whether it's left or right, then we say the name, upper or lower quadrant, right? Correct. Sorry. If you have a question on the quiz, maybe, I shouldn't say if you might have a question on the quiz that's going to ask what organ is in both the right upper quadrant and the right hypochondriac region. And if you superimpose the two, so that's the right upper quadrant and the right hypochondriac region, notice the liver. The liver is in both. So that would be what you would answer. So just know these two, draw it out, make yourself a note card, flip it over, have the grid on one side and the answers to the grid on the back side, and just study. Because this is the base. So this first lecture is the base that you'll need to know for the whole rest of the semester. Okay, so remember the pairs, anterior, posterior, dorsal, ventral. Motion also comes in pairs. So we have flexion and extension, so decreasing or increasing the angle of a joint. So look at the straight body and then look at the acute angle that you make with flexion. See how not acute really, you're just making that angle a little bit smaller. With extension, you're making that angle a lot bigger. Dorsiflexion only talks about the foot, so flexion of the ankle towards the dorsum of the foot. So remember, that's the opposite of the plantar of the foot. And then flexion is going to be towards the plantar surface of the foot. So dorsiflexion up towards the top, plantar flexion down towards the bottom of the foot. With the wrist extension, you're extending the fingers up, flexion, flexing the hand down, same thing, extending fingers up. With the digits, flexing fingers in. Flexion and extension shouldn't be too difficult. Dorsiflexion, plantar flexion should be pretty easy to remember. Extension is usually what you think about with stretching as well, right? Stretching out and then flexing in would be a good way to remember. So flexion, flexing in, extension, stretching out. Make it easier to remember. So again, these come in groups. So we have lateral rotation and medial. So lateral rotation spins out laterally. I think external rotation. Medial spins on axis medial of yourself. So internal rotation. Abduction and adduction. Abduction is going to be moving away from yourself from the midline. So abducted, you're taking away. Your arm's going outward. Adduction, you're adding your arm back in towards you. Think about that. So moving it back in. So abduction, you're moving your arm out like you're going to fly. Adduction, putting it back in. Circumduction, think circumventing, think spins 360 degrees in a circle. Opposition and reposition. So opposition and reposition are fingers only. Think opposable thumbs in monkeys. Your thumb is touching another digit. So your first digit is touching your other digits, your thumb to your fingers. Reposition is repositioning it, putting it back to where it came from, putting your thumb back into anatomical position. Protrusion and retraction. Protrusion would be sticking your jaw out, protruding it, and retraction would be putting it back in place. Elevation and depression. So elevating, anytime you do that, you're moving something, right? So elevation can be shoulders or the mouth. Elevator raises you up. Depression puts you in a down mood. So elevation's raising superiorly. So you are raising your shoulders. Depression is putting them back. So you elevate your mouth and then you depress it back. So lowers inferiorly and elevates superiorly. So elevation, think elevator raises you up. Depression, think depression puts you in a down mood. So elevation up, shoulders up, depression down, shoulders down. Supination. So supination and pronation are hands only. Supination, think about your hands like turned up like holding a bowl of soup. Supine has UP in it, up in supine. Pronation, flipping back over how you're prone to being, palms down. So you're prone to having your palms down. You're not used to having your hands in holding a soup position, supine. So that's the difference between supination and pronation. All right, we're going to do just a very quick look at imaging. So x-rays or radiographs, they're going to show dense structures as white. Fluid's going to be more dense than air. And things that are going to pop up the best on x-rays are bones and metal, super, super dense. With contrast on an x-ray shows blood vessels. Contrast is dye. An example of this, which if anybody has ever had to drink that barium and get their upper respiratory or upper GI tract, not respiratory, but upper GI tract x-rayed, that's that barium that you swallow, that contrast is going to show up as bright white. MRI, magnetic resonance imaging, super, super high contrast imaging. It's a giant magnet. There's no radiation. It's easy to see. It's not grainy. But it's not good for modal organs. So like guts that are always moving or your heart that's always beating, because it takes a very, very long time to get these images. What is really good for modal organs is a CT scan, computerized tomography. So if you do need a scan of your intestines or of your heart, typically a CT scan is done. It's good for modal movement organs. It's good for organs that are constantly moving because the images are produced so much faster on a CT than they are on an MRI. A PET scan, positron emission tomography. It looks at high metabolic activity, so it's great for the brain and it's great for looking for cancer cells. If a doctor wants to look for cancer, they're probably going to do a full body PET scan and look for lots of cellular activities. If there are tumors, they're going to show up super bright, and if there are a lot of cells in one specific area, that specific area is also going to show up super, super bright with a PET scan. Ultrasound is sonar, uses sound waves. It's a bright image of dense gallstones. It can give a bright image of babies. It's not very expensive. It's good for diagnostic purposes. It's also used in therapeutic purposes in physical therapy. Physical therapists will actually use ultrasound wands on different torn ligaments to help promote healing, which is cool. This is a plain film x-ray, so you can see bone is pretty easy to see here, and you can see this person has a filling, which is metal, a lot more dense than bone. This is an x-ray with contrast, so you can see all of the blood vessels. This one you can't see any, no contrast. Here, dye was injected into blood vessel so that these vessels could show up. Contrast cannot be used on patients with kidney problems, though. Kidneys have to be functioning pretty well to filter out the contrast, and somebody whose kidneys are not functioning as well as they should will die. The contrast could kill them. MRI with and without contrast. So this is without contrast. This is with. So you can see the contrast is exposing that tumor. This is a CT scan. So grainy, not very crisp and clean. This is a transverse view or cross section. The black space right here is air. So this is a cross section that has cut through the intestines, and you can see air in the intestines. So this person is pretty gassy. The vertebra is bright white. Ribs are bright white. This is a normal brain. This is a PET scan with a person with Alzheimer's brain. This is colorized. Typically when you see PET scans, they're actually black and white because it's a lot cheaper. And then this is an ultrasound. This is a gallbladder, and these are gallstones that this ultrasound has exposed. And that's it for this first lecture.